In this video, we will be going through some of the facets of preemptive control in the US, and later point out one technology that would dramatically improve the current traffic system in Iowa. Imagine this emergency situation. A fire truck drives down Duff Avenue blaring their siren and flashing their lights. The cars on Duff will, in theory, move to the side of the road, allowing the fire truck to go through red lights and slow-moving traffic. This isn't always the case though, and that is when dangerous situations can occur. Due to the necessity of rapid response to emergency situations, there is high risk for collisions with emergency response vehicles. From 2000 to 2009, there were reportedly 31,600 collisions with fire trucks, and there are an average of 2,600 accidents involving ambulances each year. These numbers should be much lower, as drivers are expected to operate their vehicles much slower or pull over when an emergency vehicle is approaching, but clearly this is not always the case.
One current solution that is very effective is the preemptive control system. Preemptive control is a traffic operation which grants right-of-way to priority vehicles. This system works to help these vehicles reach their destination as quickly and safely as possible. This will often take place at intersections with traffic lights capable of receiving preemptive control directives. By common knowledge, preemptive vehicles are typically thought to just include the range of police, emergency, and fire vehicles. However, preemptive control also extends to boats, trains, and even light rail transit. We will just be focusing on vehicles though. Preemptive control can be triggered through different signal types. Commonly, there will be a sensor light on the intersection crossbar, which can detect the siren or lights of approaching priority vehicles. However, some areas may have a central station control the traffic lights based on the location of the vehicle. This system works well as long as vehicle traffic is aware of the need to change lanes, otherwise the green light priority is not as effective. This is where many problems related to human error can occur.
There are several current problems related to human error when preemptive control is signaled to drivers. Distracted driving, such as drivers looking at their phone, changing the radio station, or rubbernecking where an accident causes passerbys to stare at the accident instead of making sure they are driving safely. Insufficient driver education. With a lack of continual driver education, drivers are prone to forgetting the current rules and regulations. Sirens and lights are not where drivers are looking. This causes a long reaction time from the signaling of preemptive control to the response of other vehicles to act appropriately. One possible solution is the Opticom system. An Opticom system uses flashing lights placed on top of a normal traffic light at an intersection to signal preemptive control to drivers. This particular system uses GPS and secure radio communications to signal to different intersections the need of preemptive control.
There are two major benefits to an Opticom system. 1. Prominence. A flashing light on top of an intersection is exactly where drivers are already looking. The flashing lights will also grab the attention of a distracted driver in an instant. Clarity. Once the flashing lights are signaled, it is clear to all drivers what exactly they should be doing and how to do it. Many cities, such as Sioux City, Urbandale, and the Twin Cities, use the Opticom system. In the areas that use the Opticom system as a service, the system has been shown to have significantly lower crash rates for emergency vehicles signaling preemptive control. Crash rates at intersections declined by 70% and response time improved by 25%. These improvements in safety rates and response times exponentially save more lives. Due to these situations being emergency situations, a normal crash for an emergency vehicle is much more severe. 86% of EMS are not buckled in. 44% of patients are ejected from their gurneys after crashes. And 34% of crashes by emergency vehicles result in another serious injury. Additionally, a faster response time results in a more favorable diagnosis for patients. A faster response time increases the chance to live by 7 to 10% per minute for patients suffering from a heart attack.